I just wanted to quickly thank you for taking the time to watch my Medicare Basics video. Let's get right to the presentation. Okay, there are 4 parts to Medicare that I help people with on a daily basis. And you can see all 4 of them here with Medicare Parts A, B, D, and also Medicare Supplement or Medigap Insurance. Parts A and B are what makes up Original Medicare. Part A is your hospital insurance, and it helps cover you for inpatient care stays at the hospital, skilled nursing care, hospice care, and also home health care. Part B is your medical insurance, and it helps cover you for services from your doctor, healthcare providers. It helps pay for outpatient care, home health care, durable medical equipment, and also some preventive services. So basically, Part A pays for your room and board at the hospital, and Part B pays for the doctors and equipment they use. The next major part of Medicare is Medicare Part D or Medicare Prescription Drug Coverage. Medicare Part D helps cover the costs of your prescription drugs. Medicare Part D plans are run by Medicare-approved private insurance companies, and you pay a premium to lower the cost of your prescription drugs. The last part of Medicare is Medicare Supplement Insurance or Medigap. Medicare Supplement Insurance works alongside Medicare Parts A and B and is designed to fill some to all the gaps of Medicare depending on which plan you choose. And these plans are offered by private insurance companies. Now, if you have already done some research, you may have heard about Medicare Part C or Medicare Advantage plans as well. Well, Medicare Advantage is an alternative to these 4 options and is also run by Medicare-approved private insurance companies. Medicare Advantage or Medicare Part C plans replace Medicare Parts A and B with a private insurance plan, and this plan must at least cover what Medicare Parts A and B cover. Some of these plans even offer prescription drug coverage along with some other benefits. We will compare going with Medicare Parts A, B, D, and also a Medicare supplement to going with Medicare Part C or Medicare Advantage a little later. But let's first look at how to enroll into Medicare and all the costs associated with it. So the majority of people will enroll into Medicare at 65. Now, if you are already collecting on Social Security benefits or you have railroad retirement benefits, then you'll be automatically enrolled into Medicare about 3 months before you turn 65. If you do not fall under these 2 criteria, then you can enroll into Medicare up to 3 months before and 2 months after you turn 65. This is considered your initial enrollment period. If you miss your initial enrollment period and still want to sign up for Medicare Parts A and B, you'll need to wait until General Enrollment Period. And General Enrollment Period runs between January 1st and March 31st of each year. If you enroll during General Enrollment Period, then your coverage will start on July 1st of the same year, and you'll have to pay a higher Part A and B premium for late enrollment. Lastly, there is Special Enrollment Period. This is for people that are still working past 65 in 3 months, and it gives them an 8-month period where they can sign up for Parts A and B when they finally do retire, usually without any penalties. Now, when you're ready to enroll into Medicare, either at 65 or when you finally do decide to retire, all you need to do to enroll is visit your local Social Security office or just give Social Security a call. Medicare Part A is usually free as long as you or your spouse paid into Medicare while working, and Part B usually costs $134 a month as long as you make less than $85,000 filing individually or $170,000 filing jointly. So let's now revisit Medicare Parts A and B and discuss what they cover. Well, actually it's a lot easier to talk about what they do not cover instead. So again, Part A pays for your room and board at the hospital, and Part B pays for the doctors and equipment they use. Part A and B do not cover long-term care, most dental care, eye care, cosmetic surgery, acupuncture, hearing aids, and also routine foot care. You will need to look to other insurance products to cover these benefits. Now, Part A and B also have some deductibles and copays you need to know about. So Medicare Part A, or the part that pays for your room and board at the hospital, has deductibles for days 1 through 60, 61 through 90, and also days 91 through 150. And as you can see, they are $1,340, $335, and $670 respectively. It is also important to point out that the $1,340 deductible is per 60-day benefit period, so you can end up paying for it more than one time in 1 year. Medicare does cover your first 20 days in skilled nursing facility care, and you are actually on the hook for days 21 through 100 in skilled nursing care. It will cost you $167.50 a day for days 21 through 100. Medicare also does not cover you over 151 days in the hospital or 100 days in skilled nursing care. Okay, next up is Medicare Part B, or the part that pays for your doctors and your medical expenses. Now, you will need to pay a $183 deductible before Medicare's 80/20 coinsurance kicks in. Let's go straight to an example. Let's say you have a doctor bill for $10,000. You will have to pay the first $183 deductible out of your own pocket. Then the $9,817 gets split up with Medicare paying 80% of the bill and you paying 20%. So you pay $1,963 plus the $183 deductible, and Medicare would pay $7,853. Medicare also does not pay for Part B excess charges. Excess charges are when doctors can charge up to 15% more than what Medicare is willing to pay for a test, visit, or procedure. So basically, that 20% copay can be as high as 35% with some doctors. Lastly, Medicare does not pay for your first 3 pints of blood or for anything outside of the United States. Okay, let's revisit Medicare Advantage and Medicare Supplements. You should not have both of them at the same time. You can either have Part A, B, D of Medicare along with a Medicare supplement, or you can just have a Medicare Advantage plan and maybe a drug plan if it is not already included in your Medicare Advantage plan. I said this before, but it is important to repeat it. Medicare supplement insurance works alongside Medicare Parts A and B as opposed to replacing them like Medicare Advantage does. And you'll also have to pay for your Part B for both Medicare Supplement and Medicare Advantage. Like we talked about before, Part B costs $134 a month. Let's go over some simple advantages and disadvantages for each. Medicare Advantage plans are lower cost, with the most popular plans having $0 premiums. Most include drug coverage. Most also have some small benefits for hearing, dental, vision, and wellness, with the most popular benefits being free gym memberships. The negatives of Medicare Advantage are the networks where you need to see their doctors at their hospitals. Medicare Advantage plans can also have max out-of-the-pockets of up to $6,700. Medicare Advantage plans are not standardized and can change yearly. And Advantage plans are also much more expensive in the long run for chronic conditions. Medicare supplements, on the other hand, have predictable costs. They are standardized, so they do not change year to year. They do not have networks of hospitals and doctors. And lastly, Medicare supplement plans are guaranteed renewable, so the plan stays the same for life. The only real negatives about Medicare supplement plans are that they are not free and you do have to pay a premium for them. and these premiums do increase over time. So, Medicare supplement plans are a great option if you can afford the premiums. Medicare supplement plans are standardized, so all policies offer the same basic benefits. And it's important to understand that different insurance companies charge different premiums for the exact same policy. There are 11 standardized plans to choose between, but there are only 3 that are competitive throughout the United States. The 3 competitive plans are Plan F, Plan G, and Plan N. Plan F is the easiest to understand, and it covers 100% of the gaps in Medicare. So if you enroll in a Plan F and have a Medicare-approved claim, it will cover all the deductibles and coinsurances and copays of original Medicare. Plan G is also very easy to understand, with it covering 100% of the gaps in Medicare with one exception. That exception is that Plan G does not cover your Part B deductible. As we talked about before, your Part B deductible in 2018 is $183. The last plan we'll be comparing is Plan N. Plan N does not cover your $183 Part B deductible, much like Plan G. There is also a $20 copay for doctor visits and a $50 copay for emergency room visits that do not result in inpatient admission. Lastly, Plan N does not cover Part B excess charges. Again, Part B excess charges are when a doctor or specialist can charge you up to 15% more than what Medicare is willing to pay for a test, surgery, or procedure. Monthly premiums for Plans F, G, and N are different from state to state and even for different zip codes within each state. I ran quotes across multiple states and found that on average, Plan F was the most expensive at $130 a month. Plan G was the second most expensive at $104 a month, and the least expensive was Plan N at $85 a month. And these prices make sense, with Plan F having the most benefits and being the most expensive, and Plans G and N having less benefits and being cheaper. So make sure to work with an independent agent like myself to run the cost-benefit analysis for all of these plans. Because like I said before, monthly premiums for Plans F, G, and N are different depending on where you live. Okay, the last piece of the puzzle we need to cover is Part D, or your prescription drug coverage. It is run by Medicare-approved private insurance companies, and you pay a premium to lower the cost of your prescription drugs. Now, every plan has a list of covered drugs or a formulary. So they put drugs into different tiers and have different costs for each tier they put drugs into. These Medicare Part D companies can change their formularies each and every year, so it's always important to check and see if you are in the lowest cost plan for the drugs you are currently taking. The best time to do this is during open enrollment period. Open enrollment period runs between October 15th and December 7th of each year. Changing your prescription drug plan during this time will make your new drug plan effective January 1st of the upcoming year. Now let's talk about the most popular pastry in Medicare, the donut. A donut is used to represent how most drug plans work on Part D of Medicare. So before you can even get any coinsurance from your drug company, you will first need to pay a $405 deductible in most cases. After that, you must pay a copayment. I use 25% in this example, so you pay 25% of the drug costs and the prescription drug company pays 75% until you and the insurance company have together paid a total of $3,750. Then you reach the donut hole, or the coverage gap. In this gap, you will be responsible for paying up to 35% for brand name drugs and 44% of generic drugs. Now, when you and the insurance company have paid a total of $5,000, you move into catastrophic coverage. This is when the government steps in and helps out the insurance company. You are then responsible for 5% of the drug costs from this point until the end of the year. It is easy to enroll in a drug plan for the first time or during the annual open enrollment period that runs between October 15th and December 7th of each year. All you need to do is call Medicare or go to Medicare.gov's website to set up a Part D plan. You have now graduated from Medicare 101, but in no way did I cover every specific situation or topic of Medicare. So make sure to always read the Medicare and You guidebook they send you each year to look for any changes. If you have any questions or need any help enrolling into Medicare, make sure to give me a call at 920-960-4312 or shoot me an email at medicarescreenshare@gmail.com. As always, make sure to check out another one of my videos as soon as this video ends that goes over plans F, G, and N and which plan might be best for you. And as always, please like, comment, and subscribe so we can help more people.